So can you please state your name and what your job title is?
My name is Stacy Hennon, and I'm the Director of Social Services, Human Services. I'm the interim director, actually here. I'm the director in Grant County Social Services, and have been for 10 years, and I've been here since their director passed away. So I'm filling in as the director right now.
What is some basic information about your agency?
Okay, well, Human Services provides a wide array of services, but you can lump them under kind of 3 different areas that the public is aware of or the public works with. I always say 4 because fiscal is more internal. So the first area would be social services, and that includes your protective services, so your adult protection, your child protection. It includes your mental health services, so your children's mental health, adult mental health. It includes your disabilities, so developmental disabilities for children and adults. It includes your licensing. So people don't always realize, I think, that we license all your child care, foster care, adult foster care, all daycares, all those. We do all the licensing for everything except for centers. We don't do centers. So home child care, we do all that. And then I'm going to forget something we do. Let me think. And then so we do that, and we also have senior services. We have a senior coordinator who I would fit into that category just because she fits best there, who works with our senior groups, who goes into senior clubs, teaches about things like a matter of balance, phone scams, does the Medicare Part D with them when we reach the right age, things like that. So we have that whole social services side, which runs, probably all total we run around 30 or 40 programs, because there's several programs under each of those areas. And then you have your eligibility unit, which is where we provide SNAP or food support, medical assistance, child care assistance, employment services come through there, and that's kind of the financial piece. So people who live in poverty, who don't have medical insurance, who don't have enough food, those kinds of things, that we work with them. If they're financially eligible, then we put them on our programs. We monitor their financial eligibility, make sure they get the benefits. And then on the child support side, we do all child support for people who are on medical assistance. So if you get a divorce and you're not on any public programs, you don't have to come to the county for your child support. You can, and sometimes people do. If they have a poor relationship with their ex, they'll come here, which is fine. But if you are receiving medical assistance, or anyone in your household is receiving it, then it has to come through here, because we have to collect a fee for that. So we have child support cases as well, and we collect on we establish parentage, who the father is, then we establish an order, then we collect. And so that's kind of the shortest version, really, of what we do. All total, I would say about 95% of our programs are federally or state mandated, and the bulk of them are, unlike some programs within a government structure, the bulk of ours are also have federal and state funding attached to them. So that's what we do.
What is your mission?
Okay.
Agency?
Our mission is enhancing the quality of life by providing innovative services for our community every day. That's our mission.
And what is your philosophy?
Our philosophy is really that we're here to help. We're here to help people. One of the things that really does exist is disparity in people who have less, who are poor. And our goal would be to help people that have less reach the same status as people that don't, that have more. We want to help people get through. We want to help them have enough food to eat. We want to help them have medical care so that they can be, taken care of, so they can have good health and be productive. We want to help them work. We want to help people who are disabled, and really at the core, one of the things that we do is help people that are very vulnerable. You think about vulnerable adults in child protection. Those are really people that are highly vulnerable and can be taken advantage of or hurt or injured. And it's our job to make sure they're not. It's our job to protect them and to make sure that people are protected and to make sure everyone has the same chance in life. I think that's the core of what we do is try to help people be the best part of who they can be and have the most resources that they can have.
What is the history of your agency?
Well, I haven't been here very long. The history of human services as a whole
Yeah.
is, again, these are all state and federal programs. So these are all programs that were set up at the federal level, and then they're given to the states to implement. And in Minnesota is one of only 10 states that does it this way. Minnesota delegates all of it to the counties. Other states, so like North Dakota, South Dakota, even I think Iowa, the state runs everything. So there's not a lot of local control. In Minnesota, they decided a long time ago that we thought local control would be better because who knows the people that live in your community better than you. And so Minnesota is a state supervised, county operated state. And again, we're very rare. There's not a lot of us. And so we actually perform all of those federal and state programs on behalf. And when did they start? Most of them started in the 40s, 50s, 60s. Child protection actually was one of the last ones to be established in like the late 60s. And then Minnesota has opted to take it a step further sometimes, like mental health services. In other states, they don't provide mental health services within that state operated service kind of. We do because we recognize as a state that mental health is significant to all the other things. They all play together. I mean, how do you take care of your children if you struggle with your mental health? How do you get a job and work if your mental health isn't stable? Mental health is the core for people. So we take some of those kinds of things on. But we really, we follow federal mandates at the core.
Who do you as an agency serve?
Every person in this county. And people will be surprised that we do serve way more people than they think. I think people often think of human services as a welfare agency or welfare programs, and that's not at all what we do. So if you look at your medical assistance, let's just take that for example. People think about medical assistance and cash assistance, which is a very small part of what we do, but that's what people focus on. Oh, it's that welfare mom. That welfare mom who's got 5 kids and keeps having kids so she can get more money. Not true. Not true at all. Minnesota reformed their system over a decade ago, and you don't get more money if you have more kids. You get the same amount of money and you have to manage it with more kids. You have to work. And if you don't work, you will lose your cash assistance. So cash assistance in Minnesota, our MFIT program, is $500 a month. How easy do you think it would be to live on $500 a month? Because that's what they live on. And that's until they go to work, and then we take it away because they work. I mean, our goal is to get them to work. The reality is that the bulk of what we spend our medical assistance dollars on is actually people who are elderly. Is actually, your grandma who's in the nursing home who worked her whole life but ran out of assets because people are living longer and they didn't plan or prepare for that, and they're in the nursing home for 5 years but their money only lasts 2. We pay for that. These systems pay for things like that, and I don't think people understand that. But I mean, we work with everyone. So think about every child who goes to a daycare. We license their daycare. We're the ones that make sure that their children have a safe place to be every day. Think about people that need assistance with their daycare to go to work. We are the ones that provide that for them. So we don't just do those things that people recognize us for. We do way, way more than that. It's just easiest to see us as the welfare agency or as the child protection who takes people's kids away. But we also work with people with disabilities. So we take people who have Down syndrome or who are developmentally delayed, and we provide services, we provide education. We try to mainstream them as much as possible so they do things like work in the community, live on their own, have more successful lives. A lot of our mission of what we do is surrounded around that too, not just the things that people know us for. They always know us for child protection. They always know us for welfare or cash assistance, but that's a very small portion of what we do as an agency.
Why does your agency exist?
We're required to. State and federal law require these services. I think as a country, we've decided, apparently, somewhere down the road, that we want everyone to deserve some basic dignities. And some of those things are just having a place to live and having, basic human dignity is what